Well, it starts as a common cold, then it becomes like asthma, making it difficult to breathe or sometimes even impossible. That's a virus that has spread like wildfire throughout the Denver area and is showing up here in southern Colorado. KRDO News Channel 13's Scott Harrison tracks our big story at 10.
13-year-old Will Cornejo is in a hospital bed wearing an oxygen mask. It's because he has what's called human enterovirus 68, which leads to reactive airway disease.
A couple days ago I couldn't breathe at all. My head started hurting after my lungs started sort of closing up. I mean, I feel better than I did before.
Will's parents were especially worried because he already has asthma.
Blue lips, he just passed out, had his eyes rolled back in his head, and had to call 911.
For the past 3 weeks, more than 900 children have been treated at one Denver area hospital for this severe respiratory illness. 86 of them had to be admitted. And at another hospital, half of the beds in the pediatric intensive care unit are filled with children and teens who have the virus. The same virus is now showing up in Colorado Springs.
We've probably been seeing it for at least a month, I would imagine, but I only just heard about it probably in the last week or so. Just because I started talking with some of my colleagues who had seen it before.
To treat the condition, doctors used the drug albuterol to improve breathing and steroids. Dr. Steinbrunner says the virus isn't new, it's just especially nasty this year. And although children and teens often are the most vulnerable, adults with pre-existing breathing conditions are susceptible too. Scott Harrison, KRDO News Channel 13.
And of course, we checked with the hospitals here in the Springs and in Pueblo. So far, Memorial is the only one reporting cases of the virus. Dr. Steinbrunner at Memorial says the best prevention is following normal cold protocols. Washing your hands, staying away from anyone who's sick, and most importantly, stay at home if you are sick.